Staphylococcus aureus is a gram-positive bacterium that can cause severe infections, especially in a hospital setting. In addition, it also colonizes about 20 to 30% of people asymptomatically, so without them knowing it's there or causing any problems. However, people that are colonized are at a much higher risk for infection with S. aureus. This is why at-risk patients undergo cumbersome decolonization procedures to reduce the risk of infection. The currently used procedures are not always successful, and often people are recolonized with S. aureus after a while. This also reestablishes the risk for infection. Here is where this project, Microbiota Engineering for the Eradication of S. aureus, supported by the Gebert Rüf Stiftung, comes in. In the lab, we are looking at engineering microbiomes that are colonization resistant to Staph aureus. These microbiomes could then be implanted into people's noses to establish microbiomes that can resist Staph aureus in order to get rid of Staph permanently. In order to do this, we've been using microscopic as well as macroscopic techniques to investigate different commensal bacterial species from the nose and their interactions with each other as well as with S. aureus. To investigate the interactions microscopically, we've been using capillarity-assisted particle assembly, CAPA for short, a technique developed at the ETH in Lucho Isa's group. This technique allows us to pattern bacteria in an array and then observe their growth on a single cell level. Currently, we are looking into what communities can be built with these bacteria, as well as to further develop the technique to be able to pattern patients' microbiomes in order to tailor the interventions to the individual patients.